Hello, I'm Chuck Appleby, Director of Publications for the Scottsdale Institute. Welcome to Take 5, our video interview series. Today we're talking to Joel Vengco, Senior VP and CIO at Baystate Health in Massachusetts. Welcome, Joel.
Thanks, Chuck. Great to be with you today.
Well, thanks for joining us. Today, Joel, we want to talk about an issue that's dear to your heart, the evolving role of the CIO. And I'd like to ask you, has the COVID pandemic accelerated the evolution of the CIO to business strategist, futurist, and change agent, or has it pushed it in another direction? And what is your vision of the role of the CIO in the post-COVID health system?
Yeah, thanks, Chuck, for asking that question. The pandemic has moved many healthcare organizations towards really deeply considering a mindset of digital first, whether we're talking about patients, some of whom are fearful of coming back to our hospital, or our workforce, many of whom require new ways of engaging with our patients and with one another. Through the crisis, technologies that were once thought of by many traditionalist healthcare operators as too futuristic or perhaps unpractical, have really seen technology in a different way, and there's been unprecedented demand to virtualize and digitize the way we deliver care. And so there's really no turning back at this point, and nor should we. So in order to really address this post-pandemic impact, the CIO, this role of the CIO has to really be one that sits at the table among the most senior leaders to participate in strategic discussions, particularly around redesigning the healthcare system in this new world. Many organizations are re-looking at their strategies and their strategic plans that they've developed pre-COVID, and really are realizing that they have to recast those strategies in this context of what we all just experienced. Population health, consumerism, informatics, digital, all of these just got a big boost as a result of what we experienced in COVID. And the CIO, at least in my estimation, is squarely in the middle of all these domains. And so the CIO, now more than ever, I believe, has to lean in as a business leader who is expert in technology, informatics, and innovation. And I believe that any organization today who wishes to compete with traditional and most especially non-traditional entrants in healthcare need to really listen to the CIO and have them be a participant in these strategic discussions, really across the board, clinical, business. The CIO really needs to be a part of that conversation going forward.
Well, thanks, Joel. Thanks for sharing your insights as to the evolving role of the CIO as a CIO yourself. We look forward to future conversations on this topic and many others. And thanks for taking time to take 5 with Scottsdale Institute.